Bismillahirrahmanirrahim. This video is about the heavy menstrual bleeding. Basically, in Viva, when we take history from the patient, what questions are needed to be asked from patient with heavy menstrual bleeding? Okay, so I would like to tell you that first of all, you have to take history related to the symptoms of disease, and those questions include, first of all, you have to ask about the onset of bleeding, how the bleeding started. Then the previous cycle pattern should be asked. Then the duration of the bleeding should be asked. Then we have to ask questions related to the amount of bleeding, which means that we have to ask the number of pads per day, whether those were homemade or not, and whether those pads were fully soaked or partially soaked. And then the history of flooding should be asked, history of passage of clots should be asked, and whether the heavy menstrual bleeding was associated with dysmenorrhea, dyspareunia or not, including the uterine pathology. Then we have to ask questions related to intermenstrual bleeding, indicating uterine pathology, especially endometrial polyp. And then we should ask questions related to the postcoital bleeding as well. Then we have to ask questions related to ruling out the cause, means we have to ask questions in order to come to know about the diagnosis, means we have to keep the differential diagnosis in our mind, and the differential diagnosis includes certain medical causes like hypothyroidism, or for which we have to ask about cold intolerance, the weight gain, the constipation. Then we have to ask about photosensitivity, joint pain in order to rule out SLE. Then we have to ask about facial puffiness in order to rule out the Cushing syndrome. Then jaundice, ascites should be asked in order to rule out chronic liver disease and hepatitis. Bleeding diastasis related questions should be asked from the patient. Then we have to ask about any history of TB or any history of contact with the TB patient. We have to ask questions related to the use of IUCD in such patients, and related to the drug use like anticoagulant, warfarin, heparin. We have to ask the questions related to PCOS, like whether the patient has got the weight gain, acne, hirsutism, deepening of voice, alopecia like frontal balding, oligomenorrhea, etc. We have to ask questions related to mass abdomen like fibroid, endometriosis. Then we have to ask questions related to PID, which include vaginal discharge, abdominal pain, chronic pelvic pain, backache, lower abdominal tenderness, and post-surgical history should be asked. Then history related to DNC, dental treatment, any pelvic surgery should be asked. Then we have to ask questions related to the sign and symptom of anemia, which includes the easy fatigability, palpitation, dyspnea, orthopnea, paroxysmal nocturnal dyspnea, and chest pain. Then certain obstetric history questions should be asked, like number of previous pregnancy, multiparity or not, interval between successive pregnancies, intake of antenatal folic acids or iron supplements, intake of postnatal iron calcium supplements, history of APH, postpartum hemorrhage, history of the blood transfusion and where was it done, history of the iron transfusion, whether it was done in tertiary care hospital or in private clinic, and how much was that, any reaction seen or not, and any antepartum, intrapartum or postpartum complication. We have to ask questions related to that. Any treatment got previously or what treatment done in the hospital. Women for whom treatment of HMB has been unsuccessful, we have to consider hysteroscopy, and the plan of management should be discussed with. Bismillahirrahmanirrahim. This video is about the heavy menstrual bleeding.